Hello, welcome to our dashboard presentation by Michaela Whitehead, Jenna Lombardo, Emily Montgomery, and Elizabeth Apaliokai. Today we will be teaching you about the incidence and prevention of CAUTI in the healthcare setting.
Hi, this is Jenna Lombardo, and today I'm going to be talking about quality safety measures in organization for CAUTI prevention. First, I'll talk about what a quality dashboard is, and that's a tool for displaying research data in nursing. A quality indicator is the problem to be addressed, which in our case is CAUTI. This reflects the structure and process and outcomes of nursing care related to that topic. Dashboard uses at an organizational level provides an overview of progress related to accreditation and licensure. At a unit level, it provides an overview of unit-specific outcomes in comparison to national standards. The data collection process is measured by identifying its numerator, denominator, data source, measurement period, and any exclusions allowed. A person will be selected to measure the indicator and enter it into the dashboard. A frequency is established to determine how often the indicator will be measured.
This is Michaela Whitehead, and I will be explaining the role of the BSN nurse and leadership skills in prevention of CAUTI. The best way to prevent CAUTI is through education. Continuing education for nursing staff on catheter care and CAUTI prevention is highly effective in infection prevention. As an RN, you should monitor and ensure that the following precautions and interventions are implemented in catheter care. Use of strict aseptic technique when inserting and maintaining catheters, strict adherence to hand hygiene, limitation of catheters to appropriate use only, and maintenance of a closed drainage system.
Hi, my name is Elizabeth Apaliokai. I'll be explaining significance of individual indicator in CAUTI prevention. In the first quarter of 2015, in the sample dashboard, the target population was 0 because we don't really expect anyone to acquire CAUTI. And yet, 4 patients acquire CAUTI, therefore the target population is 4. In the second quarter, in the sample dashboard, in 2014, the target population was 0, yet 2 patients acquired CAUTI, therefore the variance was 2. In both of these quarters, the target population was 0, yet 3 patients acquired CAUTI, therefore the variance was 3. The reason why we measure this is to know how many patients acquire CAUTI and to determine if the information available is sufficient to prevent CAUTI. Based on the survey of U.S. hospitals, found that urinary tract infection made up to the highest number of infections, greater than 560,000, compared to other healthcare-acquired infections. CAUTI is also leading cause of secondary and nosocomial bloodstream infection. CMC and reimbursement are a huge problem associated with CAUTI because they are not responsible for paying the hospital for complications involving CAUTI that were not present upon admission.
Hi, so my name's Emily Montgomery, and of this project I did addressing the deficits. So, evidence-based interventions and how they address the problem. So we need to minimize catheter use and the duration time. So the less we use them and the less amount of time that they're in the patient, we have a less chance of infection. We also need to remove the catheter as soon as possible whenever they're put into post-op, because that also is part of the less duration of catheterization equals the less chance of infection. We need to consider alternatives to indwelling catheters before use, such as external catheters, and other alternatives can decrease the chance of infection. So especially with males, maybe a condom catheter instead of an indwelling catheter would be recommended. Properly secure catheters to prevent movement. Preventing the movement can prevent entry of pathogens into the urinary tract. I see this a lot at work. Patients it just comes unhooked, or sometimes they don't even have one just because they keep coming off. We just can't keep them on, but that's a really big thing because it's easy for it to slide in and out, and cause those pathogens to enter into their tract. Emptying the collection bag appropriately is another very important task. Emptying the bag before it's half full can prevent the infection. A lot of people, that's something that takes time out of our shift, and it's just something that we want to just do all at once at the end. But emptying that before it's too full prevents that infection just kind of dwelling and bottling up in that bag. Also, in addressing the deficits, evidence-based interventions address the performance measures when we take extra precaution regarding CAUTI prevention and catheter care, such as what we talked on the previous slide about minimizing the urinary catheter use and duration, properly securing the indwelling catheters, and emptying that collection bag regularly. So whenever we do these interventions, the performance measure increases and the incidence of CAUTI decreases.
Hi, this is Michaela again, and I'm going to be explaining informatics and nursing. So the role of informatics in patient care includes maintaining electronic patient records, reducing healthcare costs, reducing the need for trial and error, and improving the ability of patients to self-manage illnesses. In terms of maintaining electronic patient records, many patients visit more than one health provider. Paper-based records make safely managing a patient's prescriptions difficult, as these medical records do not get consolidated across physicians, specialists, laboratories, and hospitals. However, with the use of electronic health records, systems make managing patient records easier and safer. This no longer requires patients to summarize their entire health history to the healthcare provider. They already have access to it on their computer. Another important aspect of informatics and nursing is data mining. Data mining is the practice of automatically searching large stores of data to discover patterns and trends that go beyond simple analysis. Data mining uses sophisticated mathematical algorithms to segment the data and evaluate the probability of future events. In the scenario of CAUTI, this can be very useful. Informatics can be used to determine patient outcomes and actually predict possible patterns related to the incidence of CAUTI in healthcare settings. This can be very useful in managing hospital statistics and preventing catheter-associated UTIs. As for the main point summary of our dashboard presentation, let us review what we have learned today. The role of performance data is to use the collected information to compare the statistics of a particular healthcare setting to the statistics of national standards. Observing for performance deficits is very important in a healthcare setting to help nursing and other healthcare staff understand, correct, and prevent mistakes and errors. Using best practice or evidence-based practice can improve deficits by addressing the problem that is actually causing the deficit and comparing it to information from other healthcare settings. The financial implication in a healthcare setting is important because it can result in serious economic consequences for the hospital or healthcare center. The use of evidence-based practice is very important in dashboard presentations because without it, we would not have previous data to build our evidence upon. In conclusion, without the use of dashboards in the healthcare setting, proficiency in organization would be greatly reduced. This slide represents a list of sites and sources we use to construct our dashboard presentation. Thank you for watching our Nursing, Informatics, and Health dashboard presentation by Michaela, Jenna,
Elizabeth,
and Emily.